Breast augmentation is a procedure that we perform on anybody from teenagers up to the the seniors. Teenagers sometimes are a candidate for breast augmentation. I mean, especially if there are significant asymmetries in the breast, where one side is not developing, as much as the other side. So it could be a very, psychologically devastating, condition for these young ladies, especially going through high school stage and whatnot. So we do those procedures. Although I like to limit most of my elective breast enlargement on these younger patients to above 18. I think it needs to be that in order for them to demonstrate some semblance of maturity. As far as the other limits, I've performed breast enlargements on elder 60s. Some lady who was a widow who found a recent new man in her life, and they were going away on a cruise, and she wanted to look good. So we've performed. So there's not an age limitation on who we do breast enlargement on. So, and of course, anything in between. Patients who've undergone pregnancies. Pregnancies, it has significant changes to your breasts. It will, of course, enlarge, engorge, especially if you're breastfeeding. Then it will involute or shrink back down and sag a little bit each time. It's as long as your nipple positions is still okay, then we could rejuvenate, or we could get you back to what you look like with just simply volume enhancement with a breast implant. So the candidates for breast enlargement runs the whole gamut.